Like you said, I am very much passionate about the outpatient side of treatment because I do feel like it is really where the rubber meets the road, where a lot of the skills and some of the learnings that might happen in a residential setting, for example, are put to the test, where you kind of implement those things now that you have some clarity, some sobriety, nothing in your system necessarily altering your judgments and stuff. You can really start to implement some new skills and new techniques and coping skills. It starts with maybe a partial hospitalization component where you're really spending 5 to 6 hours a day in group treatment, group therapy, group sessions, individual therapy sessions with clinicians, and easing your way back in. Ideally, I would say maybe living in a sober living environment at that time, and then stepping down a little bit to our intensive outpatient side of things. It's less hours, still Monday through Friday, usually about 2 to 3 hours a day. Just same thing, working through group therapy, individual sessions, and this is really where the family component comes in, where we like to get the families involved or re-involved. A lot of times, families, support persons get involved at the beginning, in sort of like an intervention situation. You need help, and they're there at the detox level. But then it's really, they kind of get left behind a little bit while the clients are really working on themselves. But then once they hit the outpatient part, families start to come back into the picture, and it's time to start incorporating what is this dynamic going to look like now that this person is sober, they're in recovery, they're changing and reestablishing new skills, new communication skills, new patterns. The family system also has to adjust, or the support system, whatever that might look like. Those relationships start to change too, so the families need support, and sometimes they don't know how to support a client, and so we can sort of be there to guide them. Here's what might be helpful, or here's what wouldn't be helpful. Some people do too much. Some people might need to step up a little bit or want to step up a little bit. At the outpatient level, it's really where we get into the underlying stuff. Substance use disorders don't happen in a vacuum. There's a reason, and a lot of times that's pain, that's trauma, that's co-occurring disorder, depression, anxiety, whatever it might be. That's where we really start to look at that component and address why the addiction, why is this happening, why did it develop. It's exciting to be witness to that transition for clients back into their lives, back into the real world, and to be able to walk alongside them, basically. It's almost like they're seeing maybe old people, places, things, routines through a new lens now that there's sobriety and clarity. And sometimes it's really scary. Like, sometimes it's even terrifying for them to encounter something that might seem simple but is very agitating or scary to go through. So on the outpatient side, we get to help them navigate how to handle these situations, how to handle difficult parts of their routine that might either be triggering that addiction behavior again, or might have been the underlying reason for the addiction in the first place. So we can kind of be there to help guide them through that.